And so I'm excited to go ahead and get started. Now, a key part of this, and I've dropped a few links in the chat here, you'll see on this slide here at the bottom where it says download toolkit. We'll be using a toolkit today that you can access at commongooddata.com/simple, commongooddata.com/simple. And if you go there, you'll see you can download the toolkit. You'll also receive a template, a logic model template that we'll be using today. And there's also a copy of the slides from today's presentation. So go on to that website and check it on out, and you'll see you'll receive those resources soon. So we've already done an introduction to me, so we can kind of skip by that. But I will share it as a background that I kind of bring a perspective of being a social worker. That's kind of my training and background. So that's kind of the lens I try to bring to this work. I also have a podcast that you can check out as well, Common Good Data Podcast, which we have topics on prevention, nonprofit practice, social sector practice, broadly speaking. And you can check that out on the website as well. So again, for those of you who may just be joining, who just joined in a second ago, we do have a toolkit that we'll be using today at commongooddata.com/simple. Add your email to get the toolkit, as well as the logic model and evaluation design template that we'll be referencing throughout the workshop. You can also access the slides there as well. And to make it a little bit easier to click, I'll just drop one more link into the chat for folks who are coming in. Now, many of you have already shared where you're coming from. So if you haven't yet, you're welcome to go ahead and do that. But I see we've got folks from really all over the country. And even though this is a Southeast PTTC, we certainly have folks from, I saw New York, Michigan, and Tennessee, Kentucky, Pennsylvania. And it's great to see folks from all over the country. And great, you know, we often work in our little silos and domains in different places. So it's really fun, I think, to come together as prevention professionals and folks who work across the sector to come together and talk about cool topics on prevention. So the goals for today are to focus on evaluation broadly speaking, kind of provide an introduction into doing program evaluation work. And by the end of the session, you'll be able to describe some key features of effective program evals in substance use prevention. And we'll also have a sketched out plan that you can use to evaluate one of your current programs. And that's what that template is for. So we're going to kind of walk through each part of the template step by step, and then you'll be able to kind of build out an evaluation of one of your programs right now. So hopefully this will be a learning experience from you, but you'll be able to walk away with something that is practical that you can implement right away. So a question is, why should we evaluate? Oh, we had some more stuff coming in here. I see Alabama, we see more Michigan here, Dayton, Ohio. I'm from Cincinnati originally, so that's awesome, though I'm based in Georgia now. Missouri and South Dakota, fantastic. All right, so why evaluate? Have you ever evaluated a person before or a program before, or what challenges or successes did you experience? I would love to just get a sense of where people's experiences are. And I know we've got tons of people here, so there's going to be lots of information coming in the chat. But if you could just share even a sentence or two, like, have you evaluated a program, never evaluated a program before, or maybe what are specific challenges or topics or things that you're most interested in? That helps me so that when we're guiding or going through this conversation, I can make sure to hit on some key points that I think might be useful to you. So feel free to drop into the chat any experiences you've had with evaluation, questions or challenges that you've had engaging in evaluation before. And I know that there are plenty. Oh, sorry, go ahead.
Yeah, hey Drew. Well, people are putting that information in the chat. I did get a notification that some people are having difficulty downloading the toolkit because it's being marked suspicious, probably from their agencies. Do you have any workarounds?
Ooh, let me see. Like, is it being marked suspicious when you go to the website?
I don't know the answer to that, but it sounds like it when they're trying to download it.
Okay. Well, here, let's do this. While folks are entering in some responses to this question, having people evaluated programs before, I'll see what I can do to get a copy of that toolkit, or at least a template up into the chat.
Awesome. Thank you.
Sure thing.
And while he's doing that, I can read some of these chats. Let's see. New to evaluation, that grant requirements. I evaluate several DFC coalitions currently and also working with evaluators in a previous role where I held grants. Biggest challenge is response volume. Deciding on which parts of the program to evaluate. Yeah. Let's see what else. We got some people who've never evaluated a program in here. So it looks like a spectrum of people who have a lot of experience with evaluation, and then some folks who were brand new to it. Let's see, biggest challenge is participation in the evaluation. My agency wants a thorough tool, but it takes too much time to send by SurveyMonkey, etc. Yeah.
Yeah. I mean, these are some great points, and we have, I think that knowing what to evaluate can be a really big challenge when you're trying to figure out what multiple things are. Another thing that comes up too is when you have different funders who might have different requirements, and that can be a real challenge for folks because sometimes it's like, hey, I don't know if I have the ability to, meet all the different kind of funding stream requirements and needs. Thankfully, we're starting to see more alignment in the sector on that particular issue, which is great. But I know that can certainly be a challenge. So I'm going to see here if I can get one option here that might allow us to at least get the toolkit up there, or the template that we're going to be using today. If you go to that same website that the link is there, I'm going to go ahead and add a little button in there that just says logic model template. And you should be able to download it there.
And I'm going to paste back in that website here.
All right, so that should now be available. So go ahead and go back to that same website and you'll see there's a logic model template button that should allow you to download it. All right, we're going to continue on with our presentation today. These are some great comments as well, and you'll be able to follow along with us here. One comment too that I saw in the chat, it does show up as a Dropbox link, but it does not. You do not actually have to have Dropbox. If you look on there, you'll see that there's an option just to continue in a browser and download it anyway. So there's a way for you to be able to access it that way. All right. Now, before we begin, I do want to talk about evaluation from the perspective of the Strategic Prevention Framework. And many of you are familiar with it, but for those of you who are not or are new to it, it's a really broad framework that has been kind of put out at the national level to think about how we understand the process of doing prevention work. And in that process, evaluation, you'll see, is a part of it, right? Is a part of it. A lot of times it's listed last behind assessment capacity, planning, implementation, kind of that fifth step. But I want you to encourage you to always think about the strategic prevention framework as a more circular process than a linear one. Many times we kind of think, oh, I got to do my evaluation at the end. But usually if you start thinking about evaluation at the end of what you're doing, you've thought about it too late. Because evaluation really needs to be a process that's embedded to everything that you do from the beginning. And you'll find too that a lot of the principles and skills that you use in evaluation are very useful when you start doing things like assessment, for example, or planning exercises. So you'll see that the principles of evaluation really are embodied throughout and across the strategic prevention framework. So take a look at the framework, and the toolkit that I share with you too kind of explains a little bit more about the framework and how evaluation all fits in. Now, if you might be asking yourself, why should you evaluate? Of course, you're here, so there's probably some reason that you already are bringing to this, which some of you shared in the chat already. But I think that there's really kind of three big ones, right? One is that you want to know, first and foremost, are your programs are they effective? Are they doing what you want them to do? Are you accomplishing the goals that you set out to accomplish? And a good evaluation is going to answer that question, not just sharing the things that you did, the number of people you served, or the number of programs that you put on, or the number of conversations you had. Those are all, of course, important and included in evaluation. But ultimately, a good program evaluation is also going to incorporate some element of outcomes, which is to say, what has changed in the lives of the community or the residents or the people that you served in some capacity. And that's ultimately the number one goal of the reason why we do this, is so you can gather that information to improve your programs and to also then be transparent about the work that you're trying to do. It can be challenging because we work in the social sector on social outcomes. So measuring success is not necessarily measured in profit or dollars or other easy things to measure quantitatively. It's about measuring things like how well can a youth cope with stress and mental health? How well can families have conversations about responsible behaviors and avoiding risk behaviors, which can be a little trickier, right? Now, the second reason is that because funders require it. So you might have a funder, particularly when it's coming from federal grants and state grants, that requires some element of evaluation. So you got to meet that requirement to continue keeping the lights on and continue your work. And also, there's a big piece around being transparent. And I think that this has actually become even more important nowadays. But this need to be transparent about how public dollars are being spent, which many times the work that you're doing is being supported by public dollars. And this is one way that you can kind of show that transparency to everyone about how the work is being done in your community. And to some extent, it's really all of the above, though sometimes maybe one of these 3 points might be more important or salient in your particular context. But really, it's about just being able to demonstrate that impact and in turn use that success for sustainable long-term funding. I will say that in this particular line of work, evaluation is also a bit of a fundraising tool. I know that I'm not really a fundraising consultant. I know there's a whole world of folks who are have lots of experience in development and fundraising, but it is really critical when you're doing that fundraising work to have some type of report or annual report or something that shows the work that you're doing and is able to communicate that impact. So let's talk about how we're going to do planning and designing for a program evaluation. And what I like to think about as a framing, we kind of alluded to this a little bit when we had that graphic up of the strategic prevention framework, is the importance of beginning with the end in mind. And there's a way of thinking about this called backward design. And I get this actually from the education world. I'm a former teacher myself, high school teacher, which is where I first learned about backward design, but I use it in everything that I do now. But it's really just refers to this process of starting with end goals or desired outcomes, your long-term, short, medium, and long-term impact, and then working backward to identify the steps and activities to accomplish those outcomes. Sometimes there's a temptation when you've been doing prevention work for a long time. It says, all right, we got some new funds. Let's do some more purchase surveys. Oh, we got some new funds. Let's run a communication campaign. Oh, we got some new funds. Let's do this great new evidence-based program. We've been doing it for 10 years. Let's do it again. And there's always going to be some of that when you're making decisions about how you want to tackle the particular challenge of substance use in your community. But I would encourage you to always try in the back of your mind and say, don't think so much or focus so much on what you do, but rather think more about the changes that you desire to see in the community. And as you articulate that change, that should be the driving force around how you decide and determine what you're going to do. And you may determine that, hey, we need to reduce alcohol use among high school students in our community, a very common one for prevention, right? And as you get kind of detailed into that and dive deeper into why that's happening and what you might try to accomplish and what particular aspect of that social problem you might try to tackle, the backwards design process is going to lead you sometimes in directions you didn't anticipate. And it may be that you're starting something new or different than you've done before to tackle that problem. All right, so we have a little bit of a conversation here just to get us kicked off. We use a tool called logic models to oftentimes determine or sort of describe what a program looks like. And I would love to know a little bit about your experience using logic models. And this is a cool tool called Slido. You can use your cell phone if you want to and just hold it up for that QR code. Or if you're on a computer, you can go to slido.com and enter in this code right here. And it'll say, and give you a chance to answer one of these questions. So we can get kind of a little bit of a poll. I can see we've got 9 folks who have already responded, which is awesome. So go ahead and try and respond to that poll and share your experience with logic models. For some of you, maybe you're thinking, oh, what on earth is a logic model? That's the reason why I came to this thing. But for some of you, you might be like, hey, I got all the logic model skills. I've been doing this for years and I'm so familiar. But I wanted to get a sense of where everyone is coming from before I dive into this presentation. And I think it will be fun to see. All right, now I'm going to click here. We got about 42 results in, so we'll see where the numbers come in, and the numbers sometimes go up or down. All right, we got a few that are familiar. Had to do it once, or remember, maybe not so much. All right, we got some folks who are brand new to logic models. That is awesome. and a couple of experts as well. Well, for those of you who are experts who got all the logic model skills, you can also share some of your wisdom in the chat as we go through it, because as I'm presenting on here, there'll be countless things that I probably forget to say and would love to share that wisdom across the prevention community. So don't hesitate to drop in some excellent ideas. So it sounds like about, let's see here, almost 80% it looks like, have either done a few or had to do it once but kind of forget. Well, this is actually kind of a good strategy here too. I'm trying to model a little bit some of that assessment work that we do in the strategic prevention framework before you begin. It's always good to get a sense of where things are so you can appropriately tailor the work that you're doing. And so this is good. This means that we got a good group here that is ready to learn some new stuff. And for those of you who are brand new, we'll make sure that I don't go too fast so you all can keep up. All right. Now, I mentioned the word logic model because, and I want to talk a little bit about terminology before we begin. This logic model is a term that we use to describe, a visual diagram that articulates exactly how a program or activity is supposed to operate and work, and then clearly delineate exactly what outcomes you aim to achieve. Now, sometimes you're actually going to hear the word theory of change, and you may have heard that particular phrase. Particularly if you work in a nonprofit or sometimes even in for-profit settings as well, you'll see that used as a way of an organization to communicate how they bring about their impact. And I wanted to distinguish between those two just because you might see them a little bit and know that they're sometimes used a little bit interchangeably. In prevention, you're going to see logic model a lot more, whereas maybe in like nonprofit organizational practice, you'll see theory of change. And the biggest difference between the two that I would like to kind of share is that the theory of change, when people are thinking about that, it's usually bigger, broader, organization-wide impact with kind of these big, lofty, long-term goals that are tied to kind of like a mission statement for an organization. And then a logic model is like very detailed, has very specific outcomes, has smart goals, has a lot more detail, and is often used by kind of your program staff and managers who are implementing prevention programs. So if you see these two, I just thought I would share that as a way of distinguishing between those two points because they come up a lot. All right. Now, logic models can be used for a couple of different things. Sometimes you'll see them used at the programs level and sometimes at the community level. So at the programs level, what we often see is that that's kind of like what your traditional program logic model is going to look like. It's going to specifically focus and articulate how a single program works. So say, for example, you're doing the program Too Good for Drugs or life skills training, an evidence-based prevention program delivered in schools or an after-school program or something like that to help youth develop coping skills and develop drug refusal skills, right? Something along those lines. That is like your classic program. And each of those evidence-based programs have logic models that you can draw from and use so that you can kind of articulate just what is going on and what the anticipated outcomes are. Logic models are often used a lot of times at the community level as well. So these would be focusing on community change efforts. So the outcome is not just for those who participate in the program, but rather for people in an entire community. Sometimes it's an entire county or a set of zip codes or a particular affinity group or something like that. And how multiple coordinated strategies or actions might bring about population level change. So usually in a logic model at the community level, you'll see that maybe an evidence-based program is one of a whole suite of activities or strategies that a particular organization may select to accomplish population level change. Now, for those of you who are DFC grantees or who do coalition work, where you're working across different organizations, you're probably familiar with the logic model term for the work that you've done at the community level. And you're identifying kind of those community level indicators and working towards, the community level change. At the programs level, maybe if you're a person who does more specific individual programs, launching evidence-based programs, things like that, you might be more familiar of it at that level. I'm going to try to give examples of both of these throughout, though sometimes it can be a little bit challenging to take on the community level one in the context of 2 hours because you're going to be working on it yourself here too. But know that the principles for both of these are the same. And so everything that I talk about and share with you today, you could use for either one of these as well. Okay. So let's talk about some examples of evaluation approaches. Now, I shared up here the kind of 7 strategies for community change. This is actually from CADCA. And I wanted to share some examples of how you might approach evaluation at a programs level and a community level. In the first three there, you might see, if you're familiar with this framework, that providing information, enhancing skills, and providing support, three strategies that you can use as a coalition or organization to bring about positive community change, right? And so here it talks about, for example, providing information. You might want to evaluate the percentage of community members who have increased knowledge about the risk of underage drinking after attending a particular prevention workshop or seeing a media campaign or something like that. Classic providing information evaluation approach. We just want to see has knowledge changed after you've given some type of presentation. And the same for enhancing skills and providing support. Let's take providing support, for example, you might track the number and satisfaction levels of youth who attend a new peer support group, for example. So those are like ways, and you can see how it's really linked to a particular program or action. Hey, we're going to do this thing. We're going to launch this program. We're going to do this workshop. We are going to have some type of training, and then we'll do a post survey and see, are people satisfied? Did their knowledge change? That type of thing. As you get further down on this particular kind of framework here, to 4, 5, 6, and 7, what we see is that the actions being taken are done at a community level. And so the evaluation approach in turn also changes. So for example, if you wanted to measure the increase in utilization of a local drop-in center after attending evening hours and offering transportation service, there's an example, right? Or maybe number 6, physical design, assess the impact of improved lighting and signage in public parks, or reducing incidents of drug-related activity reported to law enforcement. We're actually changing the physical design and then hoping to see some evaluation of what that impact might look like. And the last one is modifying or changing policies, tracking changes in underage tobacco sales violations after a passage and enforcement of a local ordinance requiring age verification for all purchases. Now, you'll see at the further you get down, typically the bigger the impact is across a larger group of people. And that policy change and modifying and changing policies, that can happen through laws. That can also happen through changes at the local level or state level. It can also happen in changes in organizations. You can imagine a large employer, for example, in your community, changes a particular policy around drug or alcohol use in some fashion. So these are all different ways that you can approach evaluation. And as you think about evaluation, I encourage you to kind of imagine that evaluation is going to look different depending on the type of strategy that you select. We've got a good question here in the chat. Can community be used interchangeably with project if multiple programs are used to achieve 4 through 7? I think that's probably true, yeah. You could probably use those interchangeably, and it just kind of depends on your audience or your context when you're trying to figure that out. Awesome. The logic model. So here is an example of a logic model at a community level. So you might, for those of you who are doing coalition work, you might see something that looks like this before, where you have some type of, goal statement up there. Here's an example of your problem statement, but why and why here. That's where you're trying to go, take for example, your big problem is that, our rates of use of vaping products among our young people in our community is high. Maybe it's, 20% of high school students are using vaping products. I'm making that number up. Let's say that's what that is. What's useful, oh, I'm sorry. This is getting ahead of me here. Sometimes that happens. There we go. That but why and why here column, the one right after where it says problem, it says but why and why here. What we see there is a way of taking a big challenge like 30-day use or alcohol accidents, overdose deaths, your big long-term consequences or challenges. And then you're kind of drilling down to get more and more specific and local in your community. So you're going to say, well, what causes 30-day use or alcohol accidents? Well, maybe our levels of parent disapproval aren't high enough. Maybe parents our social norms are such in our community that parents may be more permissive of youth substance use in the community. Or maybe peers are more accepting. So for example, in one's friends group, it is encouraged or appreciated to be engaging in particular drug behaviors. And so you might try to go after that particular challenge. Risk perception of harm or access. Some of these 4 core measures that we see in coalitions are good examples of these, but why, what we sometimes call intervening variables. Then there's the why here. And you have, that's where it gets to get really, really local. And you start to really focus on what's happening in your community. So for example, you might say, at our local high school, we have activities around prom. that sometimes lead to substance use, and we want to try to focus our attention there. Maybe you have a local festival or cultural event that takes place, a race car event, a football game. That's a place where you could kind of focus. Maybe there's locations of vape stores near a school, or there's a local ordinance on tobacco use. That But Why Here gets very specific to your local community. Then you start to go into your strategies to address that why here with one of those 7 strategies. And I kind of reviewed those in the last section slide there as well. And then as you move to the right, you get to your short, midterm, and long-term outcomes. And the biggest challenge in a logic model is finding ways to make sure that you have alignment between your problem, but why and by here, with your short-term, midterm, and long-term outcomes. Because ideally, they should mirror what's going on the other side of the logic model. Okay, so that's an overview of a community example. We're going to focus on a programs one, and I haven't put one here because I want you guys to do some of your own thinking on this, but this is the logic model template, which you've had a chance to download. So you can see my screen here, you can see my picture. I'm holding it up so you can see what it looks like. What I've done is kind of simplify the logic model a little bit so that it's a little bit easier to tackle. And it focuses just on your inputs, activities, outputs, and outcomes. And so I think that this approach and this template is what I use when I'm working with folks to work on individual programs that you offer as a part of your work. And it could be one of many programs that you offer. So you could do one evidence-based program or a dozen evidence-based programs, and you have a logic model for each one. But I want us to kind of focus on that level for our example today. So to do this, we had thought about doing going into small groups, but we're not going to do that because we have a large group here today. So what I'm going to encourage you all to do is just to grab a pen or pencil and to follow along with the logic model and just take any program that you're working with. And don't worry about getting it exactly right or perfect as you're putting it together. I just want you to use to engage in the exercise so you can follow along, and I'll be sharing ideas and comments and thoughts and providing feedback to you all as we put together the logic model. All right. So let's begin with goals. So every logic model should have some type of intervention goals. What is it that you hope to accomplish as a result of having completed the program? Another way of phrasing that, which I actually like to encourage folks to think about it as, is not so much what will you accomplish, but what will the participants accomplish? What new skill or ability or capacity are they going to develop? Excuse me, sorry. And as you do that, try to articulate it using the SMART language, right? Specific, measurable, achievable, relevant, and time bound. And try to kind of craft your goal such that it articulates and answers each of those 5 points. So what I would love for some of you all to do is to take out your logic model template and quickly, in 30 seconds, write a goal for a program at an organization that you work with or where you serve. Go for it. I'll take 30 seconds. And as you put your goal together, if you are willing and able, drop it in the chat and share your goal with some others. And so we can get some ideas, different perspectives on how people are approaching writing goals for their logic model. And as you put yours in, I can help provide some ideas or feedback as well. And do not worry, I will not be overly judgmental of what you put in. That is not the purpose today. The goal here is for learning. So that's what we really want to be focusing on. So drop it in there. Encourage you to do that because the more you drop in, the more I can help you as you're developing your logic models for your programs. All right. So we have one from Brittany who shares to have a minimum of 10 community partners and 5 businesses in Curry County to have either a prescription take-back container or prescription take-back bags by June of 2026. Awesome. Nice work, Brittany. Excellent. So let's get some other ones in there too. What are some other examples of SMART goals that you can have in there? Going back to Brittany's example, some strengths, right? First off, it's time bound by June of 2026. So this is going to happen in the next year. It's going to happen, which is awesome. Having that time bound piece is so awesome. It's also measurable and specific. So 10 community partners and 5 businesses to have a prescription take back container or take back bags, right? It's achievable. It's something that certainly could be done and relevant. So it's a really solid goal. A way to take that goal to the next level, Brittany, would maybe to be thinking about writing that goal from the perspective of what is it that these businesses and community partners who have access to these things, what are they now going to be able to do and bring about change in the community? So what will youth or adults in Curry County be able to do now that these take back containers and bags are available? So that might be another way to kind of rephrase that goal that pushes you to think about, okay, it's not so much that we have to have these 2 partners on board, but that they have to be distributing them, that people have to be getting them, they have to be using them. And it kind of encourages you to think through some of those things. But a great goal and very smart using that acronym. Let's see here. We've got another one from Daphne. By the end of 10 weeks, parents will learn 2 new skills to manage discipline issues with their child. Hey, excellent. That's great. So you have, time bound, 10 weeks. You've got something that's measurable. So learning 2 new skills, it's probably something that's measurable. Sometimes it's good to be a bit specific about what type of skills. Is it coping skills, parenting skills, stress management skills, that type of thing, to manage their discipline issues or challenges with their child. It's good. And you can kind of be, add a little bit of specificity in there to kind of add some improvement to it. But good. Let's take a look at Kathy's. 80% of undergraduate students will feel confident in utilizing active bystander skills in our annual spring 2026 survey. Hey, there you go. So we say 80%, so we know it's specific and measurable. We're talking about feeling confident using bystander skills, so we're specific about what that skill is. And also that it's measurable. We know we're going to do it in spring of 2026, so that's time bound. I think that's real awesome. Nice work there. It's interesting, you kind of phrase it as they're going to be able to do this by doing the spring survey. So you may mention in the goal somewhere in there just kind of a broad statement about how you're going to do that. If there's like a named program or a set of interventions that you're going to take on, you may say like, through this program or through this initiative. That way people know how you're going to bring about that particular outcome. Let's take another one here from Jesse. Increased distribution of naloxone to targeted populations. Measurable in output data collection tool and dashboard within 48 hours of notification of a county yellow level overdose alert. Excellent, right? So if you're doing a program that is trying to respond to overdoses by providing additional supports, in this case naloxone, but or other types of support right after an overdose alert has been made, a great example of a program that can be done or an intervention that can be done to address overdose deaths as well as opioid use, broadly speaking, in the community. It's specific because you've got that 48 hours of notification. It might be good to maybe be specific about how much that increase of distribution is. So if you're starting at nothing, a baseline of 0, you can say, you could get maybe like a target. Or if you have a baseline, hey, we're doing this we did 20 of these last year, we want to do 40 in the community next year. Maybe setting some type of goal around that can be helpful as well. Let's take Connie's example of Too Good for Drugs. To have the Too Good for Drug program completely implemented by the end of the month, has successfully achieved the outcome that the program needs to achieve. Good. We've got the Too Good for program, and we've got so we're being specific about it. We know what the time is there for end of the month. And I know that you're probably doing it quickly, so you don't have like Too Good for Drugs in front of you to be able to necessarily say exactly what skills are being built, right? But that's where you might want to add some specificity. What is it that you hope that youth are able to accomplish as a result of having participated in that program? So you might say something like, youth will develop, social and emotional regulation skills, our 3rd through 5th graders, as a result of participating in the Too Good for Drugs, 8-week or 12-week long curriculum or something along those lines can be helpful. Nice work. These are great, y'all. I'm going to take one more and then we're going to continue on. So Patricia shares to provide Strengthening Families program to 5 community-based organizations serving youth ages 11 to 13 by June 2026. Excellent. It's specific, measurable, very achievable, certainly relevant to what you're doing. You've got that time-bound piece. Well done. You know, and I'll say this as I shared to one of the other ones previously, a way to even challenge yourself more with that goal is to specifically articulate what you hope families are going to be able to accomplish as a result of that Strengthening Families program. And that's where it gets to that conversation of outcomes. Not so much that you're going to be doing 5 of those programs out in the community somewhere, but that you hope that everybody who does them goes from here, point A, to point B with, you know, family skills, communication skills, coping skills, always pushing us towards thinking about what is it that overall outcome is that we hope to accomplish. Folks, these are great. Thank you so much for your participation here. Great examples, and I will continue to provide feedback like this throughout the presentation here today. So I'll give you a couple examples here. These are 2 of mine. They're not perfect. You know, you could probably have someone on here share some feedback on mine too that aren't exactly, everything could always be increased a little bit. But to give you an example, the top one, vaping, is an example of a programs level. You know, when we talk about those 2 versions of the logic model. By the 2025, participating middle school students will demonstrate a 20% increase on average in knowledge of health risks associated with vaping as measured by pre and post program surveys. So you've got it time bound, June of 2025. That's only a few months from now. We'd have to move pretty quickly, right? Participating middle school students will demonstrate a 20% increase on knowledge of health risks. So we're specific about what we want them to accomplish, and we've given it a number. So it's something that we can measure using these pre-post surveys relevant to our issues and goals on vaping. So there's an example. And you'll see what I've done here, again, is phrase it in terms of the person who is participating in the program. So participating middle school students will. You know, when I was a teacher, we used to have these things called sweepas. Students will be able to. You might kind of think about it that way too. Like, what is it that participants are going to be able to accomplish? And then listing out that skill set and how you intend to measure it. So that's a classic example for your prevention programs, right? But maybe you're doing more work at the community level. And you're like, well, what is this going to look like when we're doing something community-wide? Well, that's what the alcohol example is there for you as well. So alcohol, December of 2025, increased the percentage of parents who report having regular conversations with their middle or high school age children about the risks of underage drinking from 60 to 75% as measured by a community parent survey, right? So maybe you want to have more conversations with parents and youth about the risks of alcohol. And you're doing things like communication campaigns. You're doing events, alternative activities during events that may have alcohol present. You're having conversation with school leaders. You're starting a coalition, a youth-led coalition at a set of middle and high schools. You're doing a bunch of different things, right? But they're all geared towards this main metric, which is to say we want to have more parents having conversations with kids about alcohol risk because we think if that happens, we're going to bring it down. And that's an example of what that might look like at the community level. And you'll see the key difference between the vaping and alcohol one here is that in the vaping one, it says participating middle school students. So those who actually go through the program, we expect this outcome. Whereas for the community level one, what we're seeing is that we think at a community level, parents across our entire community is what we're aiming to see that change. So great examples here. Connie adds in there, goals equals outcomes. Love this. Thank you. Thank you so much for that comment. That's exactly right. What you're going to hopefully see is that the goal section up here, and as we get to it, is going to really align well with your outcomes section. Now, the next part is actually the easiest part of your logic model. So if you're on your paper here and it says inputs here, you're going to add what are the resources needed to accomplish this goal. And I actually find this is one pretty easy to kind of go through: staff, facilities, equipment, materials. Where it can be helpful in your planning is when you start to think about things that you need to accomplish that might not be so conventional. You know, for example, you want to run a program, but you want to do a Spanish language version of it, right? Do you have Spanish language materials? Do you have a facilitator who can speak Spanish and has trust in the Spanish-speaking community in your particular area? That's the one you might want to think about with inputs, right? Do you have the appropriate locations and spaces available? Are there barriers that we know sometimes get in the way of programs? Things like transportation, childcare, access, making it a space that's accessible to youth, any of those kind of things. In the input section, the way to kind of challenge yourself to level up beyond just writing, paid staff and materials and whatnot, is to think about some of those barriers to care and try to address those in that input section. We have activities, and actually I'm going to move on to activities and outcomes here. You can fill that one as you go. These ones are a little bit more straightforward, but we'll spend time on the outcomes section. Oh, actually, there's a quick question that came in the chat. Becky asks, question, any tips on community level for increasing participation in surveys? Ooh, that's a great question. Let's come back to it. I'm going to have a section on data collection, and let's flag that question. We'll come back to it at the end. It's not an easy one, and it's getting increasingly difficult, I think, to be able to accomplish that, because we all kind of live in our different spaces now. All right, so then you have your activities or your outputs, right? And I like to think of activities and outputs as what are you going to do and how are you going to measure what you did, right? So you're going to there's an example of a goal here where you're going to do a program in 5 different locations, right? So you say, what's the program going to be? Too good for drugs, life skills training, strong families, something like that, right? And your outputs is going to be simply counting what you did. How many people attended? Who came? Well, what do we know about them who came? How many times did you do it? How many sessions were offered? Basically just counting up all the stuff you did. I kind of like to think of the output section as like you just giving yourself credit. Like check the box of all the things that you did so that you can then go back and say, yeah, you want to know what we did? This is what we did. Here's the checklist of all the stuff that we accomplished. And that's what those outputs are counting what you do. And so go ahead and fill some of that section out there too as well. You know, add some ideas in there. What are you going to accomplish and how you might accomplish it? What would you like to measure? I think too, like certainly you'll know, and many of you have probably heard this before, that we're trying to shift in the social sector field towards this outputs into focusing on outcomes. And don't get me wrong, there's definitely some truth to that. Like we need to be focusing on what people are accomplishing. It doesn't matter if you give 100 trainings and nobody learns anything, right? Like we don't want to be in that situation. That being said, I think with every funder that you work with every kind of time you're putting together a report, it's always a good idea to write down the outputs and to share them because it communicates a lot about your process and helps people to understand what it is you're accomplishing, right? And when you say, hey, you know, we ran all these programs, and you say like, hey, we do this cool program in this community, and you're just having that conversation, it gets so much richer when you say, yeah, and we this semester we're going to be doing 8 of them in 4 different church locations, and we anticipate serving over 120 families. It really gives people a sense of what you're aiming to accomplish, and that you have a really good sense of what you're doing. So I always encourage folks to collect those outputs. So hopefully you have dropped in some ideas in there in your activities and outputs section, but we're going to keep moving forward because we only have 2 hours today. And let's start to talk about short-term and long-term outcomes. And sometimes you'll see logic models where this is split up between short-term, middle-term, and long-term. But I sometimes cut the middle one because whenever I work with people, everybody struggles to figure out what they can put in that section. And I would argue just about anything you put in the middle section could probably be put in short or long. So to simplify things and make them a little bit easier for us, I just have 2 columns here. But basically, what you want to be able to show in your short term is what are the immediate results of what you accomplished. And you might think of things like satisfaction. You might think of changes in knowledge. The classic example of a short-term outcome is somebody goes to a training or a program of yours, you give them a survey and it asks, you know, rate on a scale of 1 to 5 how satisfied you were. Rate on a scale of 1 to 5 how much you knew about this topic before you came and then after you came. And hopefully those numbers are slightly different, right, with more being after. Those are kinds of examples of some of those short-term outcomes that you might be looking for. And then, and a lot of times it's about trying to capture information from participants in programs or activities right as they're happening. You know, when you got that lockbox or that cabinet lock for alcohol, did you use it? Did you go home and put it on your refrigerator, right? That's like a good short-term outcome. Now, of course, the long-term outcome that you hope for in that is that there's a reduction in alcohol use among youth around your community. But the short-term is trying to capture that initial thing. Hey, did we accomplish that little thing that we had hoped to accomplish? So yeah, that long-term then should be something that directly mirrors your goal, right? So if your goal was to reduce or increase conversations about parent and child conversations around alcohol on a community level. That's what your long-term goal should be here too. And you might also include something like 30-day use, kind of your big, sometimes harder to move big indicators at a community level. So that's how you want to think about those. So for those of you who shared goals, what I would love for you all to do is to drop in an example of what your outcomes might look like. And they might look very similar to the way you wrote your goals, or maybe you're kind of modifying your goals a little bit to try to put it in outcomes language. But try to drop in an example of an outcome. I'll give you all 30 seconds to come up with some ideas. Drop them into the chat. As you're writing your outcomes, for the purposes of this exercise, I encourage you to choose something that you can measure, something quantitative, that is going to show some type of change that occurred as a result of this program. Changes in skills, changes in knowledge, changes in behavior, changes in school suspensions, changes in alcohol accidents, something along those lines. Let's see what we got here. All right, Brittany, you're first again. Excellent. You are working quick over there, and I love it. So Brittany shares, have 10 community partners in 5 minutes in Curry County sign up for the free program. And we'll have in there how many times they're reordering the bags, how many bags from different locations are making it to Inmar, okay, and how many, at least 15 people come into the prescription take back events and collect at least 10 pounds of prescription at each event. That's awesome, right? And you can see a lot of those are going to be some of your short-term outcomes, right? How many times are people reordering bags? How many bags are coming from different locations? You might make an argument that some of those could be put in the output section because it's kind of like what you've done. I guess in this case, it's kind of like what they've done. So you're kind of like on the line between outputs and outcomes in there. But I really like the last one you have there. Collect at least 10 pounds of prescription drugs at each event. It's measurable, it's clear. It's obvious that you have done this thing to get out into the community, and then you have removed access to to prescription drugs in the community that would put youth at risk. A great example there. All right, let's look at a few of these as well. We have Vic shares 75% of students who were referred to treatment from the SBIRT program attended the first session. Excuse me, I'm talking too fast here. That's a good example because you have the number of students that you want to see referred. And the key is that in that kind of program, when you're trying to make that transition, getting people into treatment, that is the key outcome, right? Then that's the handoff to the next organization who provides treatment. They're going to take care of the next outcome there. But here, if you're that kind of intermediary organization or a program like SBRT, you're making that transition. So it's a great example. Measurable, exactly what you want to accomplish. Good example. Let's take a look at Kirsten's. Here we got, by December 31st, 2025, at least 200 elementary students across 2 schools in Marion County will have completed the 2 Good for Drugs program, demonstrating a 20% increase in knowledge about drug prevention as measured by pre-post program surveys. Excellent. That is awesome. You're specific about how many people you're going to serve. You're also showing the change, that 20% increase in knowledge about a particular drug prevention issue, right? And that would be an amazing increase. 20% is a big one. So if you can pull that off, you got some amazing facilitators doing great work in Marion County. So that would be super cool to see. That 200 students, you could potentially break that up if you wanted to and put the 200 elementary students in your outputs as the number of people you served, right? And then just the outcome itself in your short or long term. Sometimes it's helpful to do that so that your outcomes don't get too long. Sometimes the simpler they are, the easier they are to keep a head on and to manage, but very well done. We have one more from Adriana Ochoa here. Satisfaction with cleaner neighborhood, increased community engagement and ownership over the community. Long-term objective, passing down educational information on topics of littering, consistent volunteers attending on cleanups, etc. And 2 or 3 years down the road, a noticeable difference in neighborhood in regards to littering in a cleaner neighborhood. I love it. What's really cool about this example is that it's doing what I was talking about kind of at the top of this conversation, pushing yourself to get more into that community level change, that kind of big change, changing the particular appearance, an example of a neighborhood, right? And a good example here of cleaning up. I think that's a fantastic example. And you've got that short-term example is going to be satisfaction, because that's where you say, hey, are people satisfied? Are they noticing a difference? And then in that long term, you're having consistent examples of cleanups and things like that. And that's a tricky one too, because like I guess you could measure like that'd be kind of a fun experiment and evaluation of like how would you measure how much litter there is in the community, right? Like you could take pictures at different points and count how much litter is on the ground. I'm not sure. I've never done something like that before. So I really appreciate you taking on a challenging one there. That's really cool. Cassie adds, how do you choose the percentage you expect the result to be? Do you just guess? Honestly, it is a little bit of a guess sometimes. I always encourage folks, if you don't know, if you haven't done the program before, start small. And a lot of times a 5 or 10% change is actually a pretty big change for folks. So sometimes staying in that 5 to 10% change in whatever your outcome indicator is a decent rule of thumb. Now, it's not true for all of them, right? There's going to be some measure that it needs to be higher for. But I think that's sometimes a good place to begin, especially when you're looking at like your social and emotional measures of like knowledge, skills, behaviors, things like that. Now, you hope, for example, if you're doing alcohol purchase surveys and maybe you have a really high fail rate in your particular community, you might set a higher goal because that's really something that we want to see more rapid change. And by doing those purchase surveys, maybe you have an opportunity to do that. So you just kind of have to know. The best thing is to always do it the first year and kind of keep yourself an achievable goal. So that way you can go back to your funders and say you were successful, right? And then as you learn more and more about what you expect, then with baseline information, you can get more and more accurate with what you think those outcomes are going to be. So great examples. All right. Let's go into an example here. So here's an example of a logic model that is with that vaping program, right? So here's an example where you've got activities, outputs, short-term outcomes, and long-term outcomes. So say, for example, you were going to implement a 4-week vaping prevention program, something like Avoid or something similar to it. Over here, you have your activities of what you're going to do, implement the, sorry, mouse does that sometimes. You're going to host guest speakers, including healthcare professionals, for example, facilitate discussions, distribute appropriate materials, etc. Then you get to your outputs. So what are your outputs going to be? Number of classes delivered, number of students who complete the program, number of guest speakers, number of educational materials distributed. And you'll see here that each of my bullet points here, they're all aligned. 1, 2, 3, and 4 match with 1, 2, 3, 4 in outputs. Then we have these short-term outcomes that are also kind of aligned, right? So you see increase in student knowledge about the health risks of vaping, as linked to the program itself. Improved student ability to identify and resist peer pressure. So maybe we have kind of 2 outcome indicators: knowledge, resisting peer pressure, and the third one there, perception that vaping is harmful, right? So that perception of harm indicator that we've used a lot as a short-term outcome. I actually like to think in these short-term outcomes, it's a good place to put your DFC 4 core measures if you're a DFC grantee, or other similar ones that you might see as requirements from your grantees. And then down here at the very long term, we've got delayed initiation of vaping behaviors, reduction in percentage of students who report having vaped in the past 30 days. Now, I could have made those a little bit better by giving actual data, which I suppose I probably could have looked up, but I was kind of doing a general example, so I didn't have any with me. But I would improve those long-term outcomes by saying, we might say that our percentage of students who report in the past 30 days of vaping was, 20% this year. In 2 years, we hope that's 18% or 17%, something along those lines. All right, so let's go to the next one, a community level one. So maybe we were doing an alcohol communications campaign example, to address that one that I shared earlier about having conversations between parents and youth about the risks of alcohol. So in your activities, you might say, hey, let's launch a bilingual awareness campaign. Let's distribute some toolkits. Let's have some community events. We'll collaborate with schools and pediatricians to share messaging and newsletters. Basically, you're just getting information all over the community about the importance of having these conversations. Your outputs in that case, again, is going to be counting what you did. Number of campaign materials, number of impressions or views on campaign pages, number of events held and attendees that you reached, number of partner organizations that are also disseminating campaign materials. All good examples of counting what you did. Then you get into your short-term outcomes, and that's where you hope to show on one of those surveys, right? Hey, increased awareness around parents about the importance of having that conversation, increased parental confidence. That's actually a really good one. You have in the social literature things like self-efficacy and confidence. If people feel confident and they feel like if they do something, it will be successful, they're more likely to do it. So if we give parents the confidence to have that conversation with their child, it can be so powerful and leading them to have that conversation. and then greater perceived community support. And then in the long-term outcomes, we have increased frequency and quality of parent-youth conversations, and hopefully reported youth, lower use of alcohol, or sorry, lower youth reported alcohol use. I can talk. And improved perception of parental disapproval from drinking. So there's a couple of examples. You can take these, adapt them, use them to your own abilities and skill sets to put together your program. Now, because we're in 2025, this question comes up all the time. Should you use AI to generate a logic model? And I'll say yes, co-generation. Co-generation, doing it with AI can save you time and improve your work. AI, sometimes I find the problems that people have with logic models, it's not that they don't know how their programs work or what they want to accomplish, but it's just sometimes it's really hard to get it written out on a page. And what AI can sometimes be helpful in doing is just help you get across that writing block to help get out and linking those goals to outcomes. So use some AI to brainstorm example goals and outcomes based on your program descriptions. A great idea. As always, you need to know, we're all still learning with this as AI is a new tool, but make sure that you're reviewing it for accuracy, cultural relevance, alignment, things like that. And then you have to revise it so that it fits your own context, because AI is not going to have that context. It might not have local data on 30-day use in your community. So you want to be able to kind of add that after the fact. And of course, being mindful to not input personally identifiable or sensitive information into an AI. But in any case, I actually think that it can be really helpful. And so give it a try. See if you used it before to put together your logic models. It might kind of get across that mental hurdle of trying to figure out how to articulate exactly what it is you are accomplishing. So if any of you have used AI for logic models, I'd love to hear about it in the chat. Okay, now we were going to do some breakout groups, but again, I think we've got only 2 hours here, so we're going to skip this. And there's just so many people here today, I think trying to do that might be a little bit unwieldy. So we're going to continue on, but know that I do encourage you to take this document to your next staff meeting with your organization. What it is that you filled out, share the examples, share what you came up with, and maybe it'll generate some cool conversation about how you want to approach evaluation for one of your programs. So have that breakout group, not here, but at the organization or community where you work. Okay, so now that you have a logic model that shares what your program is going to be, then we have to design the evaluation for it. I know it's an hour in and we spent so much time figuring out what the program is. The second hour is going to say, well, now how are we going to do the evaluation piece? But trust me, it's always important to begin with what you're doing first, because without that, the evaluation is probably going to be designed to do the wrong things. Now, on the back side of that same logic model template, I've got a evaluation design template with just 4 questions to kind of guide you through how to design an evaluation. And these questions here on the design, collection, analysis, and reporting are questions that are adapted from many federal grants. Because what I was trying to do here was to give you a cheat sheet that you could use, that you could then implement with and use with grants when you're applying for them as well. So let's use this template on evaluation design and walk through each of the questions together. Now at the top, well, actually before we begin, it's good to talk about different types of evaluation. So we've got formative evaluation, process, outcome, and impact evaluations, all different types of examples of program evaluation. Now, the reason why we talk about different types of evaluation is because the types of questions that you might ask are going to be different depending on the goals and what it is that you want to accomplish. So for your outcomes, so a lot of times, show me the outcomes. Where are the outcomes? What's the impact? A lot of times we go straight to that outcome evaluation. But I've actually worked with a number of folks where we started with just formative process and we haven't even bothered with outcomes yet. And we do that in particular when you're doing something new that you haven't done before. And you don't necessarily know the best way to measure outcomes. And you also don't even know if what you're going to do is going to be feasible, right? Is this actually going to work? And that's where the formative and process evaluations can be very helpful. You might think of formative things like needs assessment or program design kind of questions, process around implementation and fidelity. For example, I worked with one organization and they were launching a new program. It was a evidence-based program that served families and youth, and they hadn't done it before. And we had so many things to think about, like how are we going to recruit people? When we recruit them, how is that process going to work in terms of who the facilitator is and how they're going to deliver it? Can we do it on weekday nights? Is that going to work? Can we do it in person or should it be on Zoom? What language should it be in? English or Spanish or something else or all three? We had to work out kind of all the kinks of a program. And in those situations, I encourage using more of a formative and process evaluation that focuses on doing things like interviews and focus groups, getting people's feedback on what worked and what didn't work, so you can get a good sense of how to run the program well first. Then, once you have that accomplished, then it might make sense to say, okay, let's go ahead and do that outcome evaluation. We're going to start to do pre-post surveys or other types of quantitative measures to be able to measure that over time. An impact evaluation is typically a long-term effectiveness and community change. So it's like typically involves more than one set of programs and more than one set of activities that says, what is the effectiveness of, for example, actually, you could say, what is the effectiveness of using community coalitions as a way to bring about change at the local level for substance use? That would be an impact evaluation. And there have been impact evaluations done on the effectiveness of drug-free coalitions. And they have showed some promising results, which is why you guys are all doing this. Okay, so here's some examples of some evaluation questions that you might look at, right? So we've got, when you're putting together your evaluation question, what you want to be thinking of is what is it that you really want to learn from this evaluation? Like, what's the point? What do you want to know as a result of doing it? And then thinking about your audience, who's going to use it, and how are they going to use it? And then ultimately, what types of decision making do you need to make in an organization, and how will the data inform that? At the end of the day, we don't just do evaluation just for fun. Like, we don't do it just because we want to have pretty graphs or nice reports at the end of the day. You want to do evaluation so that it helps you make better decisions on how to implement your programs, where to do them, in what format to do them. It makes you understand, well, hey, should we invest our money here or here to address this emerging outcome or challenge? You have to make decisions as prevention providers all the time. And these evaluation questions should ask questions that help you make some of those tough decisions. So some example questions for a needs assessment, for example. What are the community's greatest challenges or process? Is the program being implemented as planned? When we said we were going to do 10 sessions, did we do 10 or did we only do 8? and why did that happen, right? Outcomes evaluation. What changes have occurred because of the program? What was the change that you saw in the community or impact? What are the long-term effects that a program has had? Now, having done that, it's now your turn. So go ahead and on your, you did your evaluation of your program on this side. Go ahead and write your evaluation question on the other. Now, you may find that your evaluation question mirrors very closely your goals and outcomes. And that's kind of a very standard way of doing it, which is awesome. But you may also add additional evaluation questions in there. So it doesn't have to just be an outcomes-oriented one as well. So while you guys are thinking of that, I'm going to give you 30 seconds. And then I encourage you to drop your questions into the chat so we can take a look at a few evaluation design questions. And while we're waiting for folks to drop in their examples of evaluation questions into the chat, we had some cool conversation here around using different types of AI tools for organization and finding strengths of weaknesses and responses. Those are good examples, right? That conversation partner. And I think that certainly we're going to be learning a lot more about how to use AI for things like all different aspects of our work. And we don't necessarily have definitive answers on it, but one thing that keeps coming up over and over again is the importance of going back and forth, doing that co-generation can be a real powerful way of using the tool in a way that's going to be best fitting your needs. All right, so for evaluation questions, let's have a few come on in here. I see Tom as one. How do you define success? Interesting question there, right? So I'm not sure if you meant that for me, like how do I define success in a program or something like that, or if it's more of an evaluation question. But let's take it as if it's an evaluation question. You wanted to know, how is it that participants in some program or activity that you do define success? Imagine maybe that you're doing mental health or counseling work and you're working with individuals in recovery, for example, and you want to say, hey, what does success look like for you? What does a goal look like for you as a result of this program? And having an understanding of kind of the richness and the depth of what those goals can look like, and how sometimes they're often very different than what we as prevention professionals or as substance use professionals might think they are, I think can be really, really great as well. Any other fun examples here of evaluation questions? We have a lot for our goals and outcomes, but a lot of reticence when it comes to evaluation questions. Awesome. We have a question in here. What is your perception of cannabis use safety? There you go. Okay, awesome. So asking, kind of getting a sense from users, you know, what is or from participants in a program, the perception of safety, right? Now, what I should clarify in here for evaluation questions is to think about this not so much in terms of what question would you ask on a survey or an interview or a focus group, which you might do in that case. But rather to ask a broader question about the program in general. So I might encourage you to think about how to rephrase that in this context would be something along the lines of, you know, maybe you're doing a process type evaluation or formative one, and you want to understand what is participants' understanding of cannabis use safety. What are people thinking in the community around that particular topic? You can imagine doing some great focus groups on a question like that. I think that'd be a really, really cool and interesting question to ask, actually. Let's see here. Alexandra says, did the program achieve its intended outcome? Excellent. Yeah, I mean, that's a very straightforward type of evaluation question. You could add the specifics of the program, the outcome, and what that outcome might look like to strengthen that one in there too, right? Do students gain, Daphne shares, do students gain skills after completing the program? Yeah, exactly. Like, did we see a change as we had hoped, maybe in the goal section, in skills between pre and post, right? Let's see here. Karen says, did the program reduce the number of alcohol incidents for the fiscal year? Excellent. Yep. So we ran this program, and then we want to know, did it reduce alcohol incidents? A perfect example of an outcomes evaluation. And Jesse shares a similar example there. We're seeing incidents of overdoses and treatment emergency services decreasing from the year's average. Excellent. Good examples. Great topics here for your evaluation design questions. Now, you may have more than one here. So you can include always at least one to kind of guide your conversation, but you might have multiple. And depending on what your questions are, you might actually choose different evaluation approaches. But we'll go ahead and dive in as if you've got a question and talk a little bit about how you might approach your evaluation design. Now, for your evaluation, a lot of times we use kind of two different kind of broad categories of evaluation strategies, your quantitative versus your qualitative. So your quantitative designs are going to refer to numbers, stats, describing trends, behaviors, larger groups of people. And it's going to focus on getting you those measurable outputs and outcomes, how many people you served, et cetera, and your outcomes being those measurable changes in behaviors, attitudes, skills, et cetera. And so many of you are going to be in the quantitative camp, particularly as well because we often have requirements from grantees that meet particular benchmarks or outcome indicators that are measured typically quantitatively with those numbers and statistics. But we also have the qualitative side, which is going to focus on narrative and storytelling. It's about giving meaning and making sense of data. Helpful, I think, in particular for pilot studies and getting initial feedback from folks, especially when you're starting something new, as I shared before. Improving service delivery. You can even use it too for testimonials for people to get a sense of, describing their experiences and perhaps successes in the program or activity that you helped put together, and then to hear that impact in their own words. Now, increasingly, what I'm seeing across the field is a mix of these two. And I encourage a mixed methods approach whenever you can, because they answer different questions and they accomplish different things. You can see the types of questions and approaches that you would answer with either of these are very, very different. But they both offer something so incredibly rich and important and needed in evaluation work. So we'll be talking about both of those today. Now, there are lots of different program evaluation designs, and if you were to take a textbook from a graduate level course in some type of social science that goes into program evaluation, you'll probably see like a dozen different designs, and they all have a lot of fancy jargon. But what I'll share with you are just 3 plain and simple approaches to evaluation that I see most people engage in. And then you can kind of take this and run with it the way you want to. So for a program where you're maybe it's an evidence-based program, Too Good for Drugs, for example. A lot of times what you'll see is either a post-quantitative design where you have just a survey after training, a program, an activity, where you measure things like perceptions of increased knowledge or satisfaction. That's kind of one example. To strengthen that evaluation a little bit is you could do a pre-post design. And that would be able to maybe measure change over time. Because the idea about a pre-post is that people are responding differently at the end than they did at the beginning on those same measures. And so that helps to show that change over time, which adds a little bit of strength to it. And then a lot of times you'll see a mixed methods approach too, where you combine that pre-post quantitative design, but also add qualitative elements, things like focus groups and interviews to understand participant experiences in programs. So those are the 3 that I see the most. Now, it's not to say that there's one that's better or worse than others. For example, in a post-quant design, we're going to be doing a post-quant design in this training. You're going to be asked to complete an evaluation when you're done to say, hey, was this training good? Did you learn anything in the last 2 hours with this guy up here talking about evaluation? And it would seem kind of silly for us to ask you, maybe not silly, I shouldn't say that, but it might be burdensome to ask you to complete a test of your evaluation knowledge beforehand and then have you complete another test afterwards. Because you're busy people, you have to run to meetings and you don't have time to take surveys all the time. So maybe it makes most sense to just do a simple survey at the end. That's where that post-quantitative design is so powerful, because it's very easy to do and quick to do and oftentimes the least burdensome. But the challenge is, when you're working with youth and you're talking about social skills, the ability to have conversations with your parents about risky behaviors or alcohol use, they might not have all of us, and not just youth, but like we all have kind of difficulty maybe being aware of what has changed in our perceptions or ideas. And so having that pre and post survey can help us capture what we're thinking at one period of time and another, without perhaps the bias or social desirability bias that we have when we want to make ourselves look great and smart on surveys. So those pre-post quant designs can be helpful there as well. And then for mixed methods, I love doing this, especially when you're trying to talk about not just outcomes for a report, but really to communicate to others about the importance of an experience, especially when that experience involves transformation in the participant in some capacity. Somebody who goes to a program has some experience that's so transformative for them, and having them express that in their own words and why that was important to them, what they saw changed in their lives. That often describes things that you don't capture in a survey. That you have those open-ended questions that allow you to gather a richness that is not always seen there. So anyways, those are some different evaluation designs. Now, the one limitation with each of these designs here is that none of these can establish what we call in the research world causality, which means you can't say just because there was an increase or a decrease in a particular outcome indicator in any of these that your program caused it, because it could have happened for some other reason. And to give you an example of what I mean by that, let's say you were doing some type of initiative and you started in the August of 2019 school year. You were doing life skills programs across the entire school year, and you were going to do a pre-post in August of 2019, and you were going to do a post in the May of 2020. And you were doing these programs all year long across a bunch of different high schools and middle schools. Well, if you took pre-data and post-data, you were looking at, for example, tobacco use or vaping product use, you might notice that there was a big drop-off in May of 2020 compared to August of 2019. And you might say, oh, my program did such a good job. We saw this huge reduction and fantastic. Our program is amazing. But that would also not account for the fact that the law was changed in age for tobacco between the ages of 18 and 21, which had a huge impact on vaping and tobacco use in high schools during that time period. And it really may have been more due to the policy than it was to your program, or hopefully in some cases you would hope a little combination of both. And so that's why we can't have causality in these situations, because you can't control for these external factors that may have otherwise impact the outcomes that you're seeing in your program. So we'll skip this one for now. I'll come back to that just because we are a little on time. The way we do that in the evaluation world, how do we control for that, is doing something called randomized controlled trials. And what you do here in this situation is it's the most rigorous, and it can establish causality because it includes a control group for randomization. Now, the challenge is that, of course, it's very difficult to do randomized controlled trials because what you have to do is collect a bunch of data on, for participants who don't actually receive a treatment. I have a picture here of a two-receiving vaccination because many of us remember in the COVID days when there was all these clinical trials going out for vaccines and they had to test, did this vaccine, reduce a risk of onset of COVID before and after. And so that's kind of a good example. That's I feel like the one paradigmatic example of a randomized controlled trial that most people are familiar with. But you can imagine if you wanted to test the efficacy of the Too Good for Drugs program, what you would do is have 500 youth who want to participate, 250 get the curriculum, 250 don't. And then you do your surveys pre and post afterwards. And there's no difference between those two groups because you randomly assigned who got into one. Not like, oh, these schools and those schools, because the schools are different. You truly randomized it. That's the best way to know if something has had an impact. And if you are using an evidence-based program, and it says this is an evidence-based program, it means that somewhere along the lines, a researcher has done a clinical randomized controlled trial of that particular program. That's what an evidence-based program means. So we can have some confidence to say, we know that this program, we believe, there's evidence to suggest that it may have caused a particular outcome. Now, in most cases, you're never going to need to do a randomized controlled trial because the joy is that the researchers take care of that, and we as prevention professionals in turn get to just work on implementing. We take those programs and ideas and we implement them in communities. Now, we still do evaluation because we want to be learning from them. We want to understand, we want to be able to show and demonstrate impact and improve our programs all the time. But hopefully what we're choosing are programs that have had these RCTs done before. Now, for you all, how do you choose then the design? So I kind of talked about this a little bit before, but posts are quick and easy. Pre-post, you get to see that change over time, adds a little bit of element to it. The mixed method adds the nuance that comes with qualitative understandings of participant experience in particular. And then the RCT, which is best for impact, but you'll need a researcher and some funding and a lot of time to be successful in taking on an RCT. Okay, there are other evaluation designs here. This is not, there's certainly more that could be here, but this is enough to give you a bit of a flavor of what they look like. In some cases, you may want to actually hire an evaluator to help you with this work. And usually you want to do that when you have something complex going on. Maybe you got a very big program going on and lots of little different pieces that are going on. Maybe you need somebody who's a third party who can be objective and unbiased, or at least maybe you feel like you could do that, but the community is going to want to see an external person to provide that objectivity in a particular context. Maybe you don't have the capacity. You need to hire somebody else because internally you don't have the capacity to conduct that. Or you're working on major grant proposals. And so if you are interested in some assistance with an evaluation, you can actually fill out a TA request to the PTTC. And Amber is going to drop in a link to that TTA request, or sorry, technical assistance request form that you can use to get some assistance on how to do evaluation work. So go ahead and check out that request form, and you can use that to gather some ideas and feedback on how to work. All right. Now, your turn. So we're on the next section here. Select an evaluation design for your program, pre-post, or mixed methods, and then describe how you would set up the evaluation using this approach. Would you use a control group or not? Would you randomize? How would you kind of approach some of those challenges? So I'll give you 30, 45 seconds to try and tackle that. And for those of you brave participants out there who are listening in, go ahead and drop in which one you chose. And if you can, maybe a little bit of knowledge about her detail as to why you chose that particular approach in your evaluation design. And while we're doing that, Amber, I think there's a question for the PTTC in there.
There is no fee associated with utilizing our services for TA requests. Great question. We are 100% funded by SAMHSA.
Amazing. You can get that help and it doesn't cost you anything. Hit that button, y'all. All right. Let's have some brave souls share their approach. What can you add in there? What approach would you use for your evaluation design and why? Of the ones that we talked about. Tom shares a mixed method, which would provide that opportunity to draw the qualitative data while also providing the quantitative data to support findings. Excellent. I love it. I think, and depending on, obviously, the nature of your program, I'm trying to remember some of yours from before, but I think that would make a lot of sense. Corey shares that their program does a pre-post with mixed methods. Awesome. Giving surveys to youth and conduct community readiness assessment to understand the perceptions of the issue that you're trying to solve. That is super cool. I love it. Awesome. And that example of having the youth take surveys and then also having the mixed methods piece, classic example. Georgine shares pre-post because participant growth is most important to know. Excellent, very good. Amy shares pre-post as well about showing the gain in knowledge. Brittany talks about how there's lacking of public health data sometimes, and so data that is well-rounded can help us achieve goals. That's really interesting. A lot of times when you're doing your needs assessment, one of the things that you're going to do is identify the data gaps, right? What are the information that we are not collecting at a local level on a particular area related to our challenge? And sometimes, you kind of have to adjust your evaluation based on what information you have. So for example, some communities have really fantastic opioid dashboards. So they have a really clear understanding of things like emergency room visits, overdose, deaths, things like that from different kind of public agency reporting, which can be really helpful when you're trying to guide your work. But some communities might not have access to that, or they do, but it's not at the same level, right? Maybe they aren't able to break it down by different subgroups that they would like to be able to do. They don't know what ages, for example. So that's a good example where sometimes your evaluation can fill some of those gaps. Lots of pre-posts in here. Let's see here. Some good examples and questions here. Excellent. Michelle mentions that legislation is difficult for surveys to obtain from youth due to informed consent required. Any suggestions? Yes, we got to definitely talk about that. And actually, I will give you all a highlight on the, I'm going to talk about quantitative data also in the third session in this series, where we're going to dive into that in even more detail. So we'll know that more detailed conversation on that particular challenge is coming up. I know for a lot of folks, and I live in a state where that's the case as well too. All right, some great examples. Oh, we had our question here, but people have entered in the chat, so we'll go ahead and skip this one. I forgot that I had this slide here to see if you could see what people chose. But we'll kind of move on forward here because we have about a half hour. Good. Okay, so let's talk about data collection. And so now you've got your design in place and how you're going to do it. Now let's actually talk about some of those data collection tips. And maybe we can answer some of those questions, at least briefly, with respect to quantitative data collection. First, it's always good to begin with a data collection plan. Have just some kind of written document that says what you're going to do and how you're going to do it. As a part of that process, it's good to ensure good privacy and ethics approaches when you're doing your data collection. Informed consent came up as one of those key pillars that we associate with doing good evaluation ethics. That's an example of that. So you may ask for either legal assistance or an IRB, some expert, maybe an evaluator, somebody who can provide you guidance on some of those data collection if you feel like you need that. And you can also get training actually too in human subject research. They have these 2-hour trainings or 3-hour trainings you can take, which I think are very useful if you're going to be doing a lot of data collection work. You also want to think about capacity. So who in your organization is going to take this on? And what are the skill sets that they have or they might need to develop to be able to do the work well? Maybe brought somebody on they've never done focus groups before or launched a survey before. What type of additional supports could you help that in particular colleague of yours develop so that they could do it and be successful? Another idea too with data collection is to use standard tools. Sometimes there's a temptation to write our own survey questions, and to some extent you can do that, but I would encourage you to think about not reinventing the wheel. Especially if you're using an evidence-based program, most of them actually have questions already written out that you can draw from. And then when it comes to things like demographic questions, drawing from the census and some other standard sources can be helpful. All right, let's keep going along here. So data collection table. I actually love to, you'll see tables like this sometimes actually in federal grant proposals where where you just kind of outline over here on the far left what your outcome or indicator would be. You could take that directly from your logic model and then describe specifically how it might be measured, and then talk about when you're going to collect it, who's responsible for it, and then what type of analysis you might do. And here's an example of how you might complete that. Say, for example, youth will demonstrate statistically significant increase in the perceived risk of harm for vaping products. Then you say that you're measuring that using one of the 4 core measures there, percentage of youth that say there's moderate to great risk to using vapes. You collect that doing a pre-post survey. You say that your evaluator and program director are going to be responsible for it. And you're going to measure the difference by comparing means, that is the average of the score at the pre and post, and do a test of statistical significance. Now, I don't know if any of you all have had a stats course before. When I say the word statistical significance, that might bring up some bad memories of a stats course you've taken before. So bring on an expert if you need to in that situation. But all that really means is to say, is the observed change that you see something that was likely to have occurred due to chance or likely to not have occurred due to chance? And that's ultimately what statistical significance is trying to determine for you. Were you just lucky, or do we think, hey, there actually might be a relationship here between program participation and some outcome? When you're using different kind of approaches, the 3 that come up the most, and I've already referenced them so many times in this presentation, are surveys, interviews, and focus groups. And the reason these come up is because they're relatively easy, straightforward, and we have existing tools and processes for doing those types of data collection tools. And here's kind of an example of your strengths and limitations for each of them. I think surveys are great when you want a large sample, and typically 40 or 50 or more people. When you're doing a survey of 7 people, it's usually not that helpful to have quantitative measures because the sample was so small. It helps for the big groups of people. Now, you might be doing a program that only has 10 people enrolled and you're doing this one program this year. But if you run that program for 4 years, all of a sudden you hit 50, 60 plus people. So it may be worthwhile to do a quantitative survey, but just extend your time frame for data collection. The strengths for your interviews and focus groups, again, it allows that richness and allows for those probing follow-up questions, open-ended questions, revealing information that you didn't think of or that would not have come to mind for you. But it can be challenging because it can be time-consuming or costly. You can't do hundreds of interviews. Just doing even 10 interviews is a lot of work, a lot of time, and then you got to analyze all that data. So there are certainly some constraints, and it's best for working with smaller groups for those. All right, keep moving along here. For surveys, checking your sample size, making sure it's slightly larger, using existing questions or consulting with an expert can be wise. Limiting the length. Surveys, we are all surveyed so much. And you've all been a person who's filled out a survey before and know what it's like when you're getting through and you're like, when are the bubbles going to end? So as you think about the respondents as you're putting it together, and only ask the information that you absolutely have to have and to try and limit the burden on respondents. And always test it out too. Send it to a colleague to say, hey, does this look right? Do the buttons work right? When you click on it, does the link work? All that kind of stuff is really important. And as I shared previously, we are going to discuss this in more detail during the 3rd workshop. Now, I do want to talk a little bit about, let's see here, there was a question previously about how to increase participation in surveys and handle things like informed consent. And as I shared, I'll share more about this in detail in the 3rd workshop. But a couple of things to keep in mind. One is that a lot of communities had been doing surveys that had kind of opt-out procedures, especially if you're doing it in a school. So the idea was that you would send a notice out that the survey was happening with youth to parents, and then maybe say, if you don't want your child to participate, go ahead and opt out. And a lot of laws have been changing to require opt-in, where parents have to provide their consent before you begin a survey of youth in a school setting. And one of the challenges with that is that school districts often talk about how it might be difficult to get back from parents. And also when you get that information back, the parents that are likely to respond and their kids are maybe different than those who are less likely to respond to a particular survey. So you run into some sample bias challenges with those questions. One thing that I have been seeing some organizations do to address this challenge is to think about when are the best points of contact with parents, and how do you integrate your consent processes into that moment. So for example, during school enrollment, when parents are filling out paperwork at the beginning of an enrollment year, say ninth graders going to high school, they have to fill out paperwork before they enroll in that high school. If you work closely with the school district and integrate maybe a consent procedure for a school-based survey, for example, as a part of that enrollment project, you might then have a chance to have more certainty that all parents are going to be able to see it and then provide their consent or not. So that's kind of one strategy. Other also would be like during open houses, other types of events can be important as well. Now, I also am a parent of a child in the school, and many of you maybe have had that experience too. And you feel like you're always getting information, and you're like, what do I got to sign? And sometimes it can actually be kind of hard as a parent to keep track of it all. So how do you make it easier for parents? I think is always a question that you want to be asking yourself to make it easy for them to complete those surveys or those consent forms. In addition, I think trust is so important. You know, like when people see an organization and they don't recognize who you are or what your logo is or what you do, they might be less like, they might read your consent form, but they might just say no. I already have too much data collected about myself and my kids. I'm just going to say no to whatever this is. But if you're an organization that has been putting in the work over the past 3, 5, 10 years, that shows up in schools and that is there and present with families and asks questions, and is very present in the community, your chances of success in having a parent be more willing to consent to a program, I think, would probably go up. So it's not just the actually process of getting the consent form out and getting it back, but it's also what are the strategies you can have for your organization, building closer relationships with schools and closer relationships with parents. And I'll say, yeah, I know that it's been challenging for a lot of organizations who collect this information and need it for their work to have these consent procedures in place. But I do think that with some of these consent procedures, it's helping, I think, us as a field think even more critically about how to develop strong, trusting relationships with parents, which is what we need to do anyways. And so in a way, it's almost an opportunity or a challenge for us to be even better in our work. So that's a bit of a few ideas about informed consent. I'll share more of that on our conversation on the third workshop. Zach here has a question too. Do you have recommendations for resources about other evaluation designs interested in expanding to more robust methods? Yeah, a good social science research methods textbook would be great. I like also the community toolbox from the University of Kansas. They have great resources there that you can check out. Fill out that TA request for the PTTC. I bet you they're going to connect you with somebody who can certainly help with that. You know, I'm working on, there's a lot of really cool projects happening with local data as well. I'm involved with one project where we're actually developing a comparison group using administrative data at a county level to compare people who participated in a particular program and those who did not. So sometimes you can have access to administrative or state level data or county level data, local data that might actually allow you to do some cool linking and cool, what we call quasi experimental research studies as well. So that's another kind of idea for how you might approach that. And Amber just dropped the University of Kansas toolbox in there as well. So Zach, great question. Thank you so much. Now let's talk a little bit about interviews and focus groups. The key here is that what I love about interviews and focus groups, and for many of you who have a background as a clinician or in mental health or who just do work having conversations with people, you know the power of open-ended questions. You know, tell me about this experience. Say more about that. Repeating back to people, this is what I heard, is that right? What would you change? You know, and what you find with the open-ended questions is that so many times you gather information that you had no idea was gonna come up in that conversation. And that's why I think interviews and focus groups are such a great complement to surveys, because surveys, we have our prescripted ideas about what we want to see change happen. And then what you'll see in a focus group and interview is what does change look like from the perspective of the participant, which is often very different. Some strategies, it's always important to build rapport and trust early on, to stay neutral and non-judgmental, and using person-first language, things like that when you're having those conversations can be really important. Many of you are aware of those skills. Active listening and following up making sure using body language and eye contact. Some of those strong facilitation skills, especially for focus groups, are really, really important. Increasingly, it's become easier and easier to do to record and transcribe a lot of qualitative information. And that I think is really helpful, because if you're always just writing down notes of everything that everybody says, you're probably not going to capture everything. You might capture things incorrectly. And having that record and transcript of the focus group can be really, really helpful. Always be mindful, though, that you got to be careful with that information and that it's safeguarded properly according to good data security protocols. And, it's always important, too, as a facilitator to not be afraid to jump in sometimes. Sometimes you'll have a conversation kind of go in a direction you didn't think it was going to go, and you got to reel things back in together. And that can be scary for folks, to be that person that says, like, thank you. We need to hear from somebody else who hasn't talked yet. Something along those lines. And so you can practice that a little bit with your colleagues, maybe before you dive into a focus group if you're doing it for the first time. All right. And yes, we will also have focus groups and interviews. We're going to talk about that in the second workshop series, which will be coming up soon. All right. Now, one thing that comes up is the concept of incentives, right? So should we pay people to take surveys? Should we pay people to do focus groups or interviews, things like that? So I would love for you all to share in the chat, have you ever used incentives before, and how have you structured them? Maybe share, how much did you budget for it? Did you give it to everyone or just do kind of a lottery? Do you feel like they're actually helpful in helping with participation or not? What are some of your ideas? So I'm going to give you all 15 seconds to drop some answers in there. All right, so Andrea says for their community health assessments, they provided $50 gift cards for focus group participants. Great example. And so important for community health assessments. Man, focus groups are the best for CHAs, right? Because a lot of times the health challenges that communities are experiencing aren't going to be captured well in a survey. And it gives you a good sense of what's happening at the local level. Excellent. Ooh, giving away t-shirts. That's kind of cool, because then you get a little bit of like your branding and your word and your information out there. I love that idea. I have not seen that before. Thank you, Jacqueline. I appreciate that. Grocery gift cards. Excellent. Awesome. Limiting the group size to 10. Awesome. Yeah, that's a good idea too. To keep those focus groups small. If it gets above 10, it gets really hard for everybody to participate. So having those a little bit smaller can be cool. Ooh, and across 4 counties. Awesome. Coffee cups, winning prizes. These are great ideas. As a reward, $25 for completing all 4 surveys throughout a 6-month program. That's kind of cool, using it as a kind of incentive, because sometimes you have drop off, right? If you have a bunch of surveys that you have to do, and sometimes having that incentive come at the end is great. Awesome, we have some great examples in here. I love the crowdsourcing of ideas around incentives. $50 gift cards, random draw for campus experiences like football games and movie passes. Oh, that is awesome. I love that. Like you could get passes to a particular thing you could participate. Super cool. Oh, there you go. $1 bills and close with the survey. That's very simple, and people can use it right away, right? Gift cards to Walmart and things like that too. Awesome. Great examples here, y'all. These are fantastic. Thank you all so much for sharing. All right. So what are some other tools that you can use? This is not an exhaustive list, but these are some tools that I've used before and some others you may want to use. Certainly, I would say that you can do quite a lot in Excel. So some people think, do I have to get a fancy statistical software, something like SPSS or Stata or R or something like that, which are great and have their purposes and uses. But if that seems like a bit too big of a lift, start in Excel. And you can accomplish a lot in terms of just getting simple demographics, dashboarding, even some pre-post analysis as well in Excel, which can be very, very helpful and useful. I have an example here of Zoho Survey for creating and distributing surveys. There's a ton of them. You have SurveyMonkey out there. You have Google Form. There's a bunch of them. Just keep in mind what the different kind of restrictions are or on data and privacy, particularly around children, because some of the surveys have different policies on that, so you want to keep in mind. For transcription of interviews, sometimes it can take a long time to try and write everything out, listen, hit play, rewind, to try to write everything out. And AI has gotten really good at doing transcription work. I've been experiencing with one called Mac Whisper, and what I like about it is that it does the data locally, so it doesn't send data to the cloud, which is a potential security risk. But depending on your situation and security needs, it may be a good fit, it may not, but it's one you can try out. Stata is one I love for advanced analysis. Deduce for your qualitative data tools. It's really, really great for, actually you can do a little bit of quant too, but Deduce is a great tool for you having a bunch of focus groups or interviews. And then there's a tool called Tremendous, which I recommend as well, that may work for your needs depending on what you're trying to put together. And what it allows you to do is to distribute incentives by email, which is kind of helpful when you're trying to get a bunch of gift cards out. And it has a nice way of keeping a track record of how they all got sent out and whatnot. So those are some useful tools. Again, with any of these tools, you're going to want to have a good analysis of, do they fit your needs? Do they meet your privacy and data requirements? Because not all of them will. But they're good ones to check out that you may find useful. All right. Informed consent. So we talked about this a little bit before, but that process of informed consent is basically whenever you're collecting data or information about someone, you should tell them what it is, why you're doing it, what the risks and benefits are, how you're going to keep that information secure, right? Those are your things you want to include. I find it helpful too, as a tip, to include your informed consent for your evaluation work as a part of your intake and enrollment paperwork. So if you're enrolling somebody into a program and you're gathering information like contact information, so you know who they are and how you can get in touch with them, include that informed consent for your repo survey in there, so you can kind of get that all done at the same time. Kind of as I was alluding to before with surveys, the way, try to put yourself in the perspective of the participant and reduce all the barriers, and so that if you can have it all done at the same time when things are already happening, it increases your likelihood that they'll be reviewed and completed. Consent should describe the intervention that you're doing and a summary of the risk benefits of what you'll do with the data and how you protect privacy, etc. It can be helpful here if you want to speak with an expert, as I referred to earlier. A trained evaluator, institutional review board can be helpful. Research offices, attorney for legal questions if they come up. Just so you have another person looking at it, because with research ethics questions, having more people review your materials, especially those with some expertise, can be helpful to ensure that you're complying with research and ethics guidelines, evaluation ethics guidelines, and any legal concerns should they come up as well. Here's our incentives page. I think it got flipped around somehow. I must have done. Anyways, we've kind of talked about this, but my recommendation there for surveys is to try to have more than one winner and have enough so that if you're doing a lottery, if you can't pay for everybody to take a survey, try to have between 5 and 10 winners, and to have a decent range in there. Again, that's going to depend on your funding. And then for focus groups, between $20 and $30, or even as high as $50. Sorry, that was a lot of words there. My apologies. Let's look at administrative data. So a lot of times you'll have data that you could use for evaluation purposes that is administrative in nature. So, you're collecting just contact information of who's participated. Maybe you gather some demographic information that way. So there might be ways that you can link that data to what you're otherwise using to not have to ask somebody to fill out their age and gender and race ethnicity every single time they interact with you. That's one way you could use administrative data. And then, you may have information in enrollment forms or in other types of gathering information that you have that you could use for evaluation, so you wouldn't have to then go gather it somewhere else. So just kind of think about that as another tool that you can use. There are also going to be secondary data at the local level. So, I gave the example of opioid dashboards, use surveys that are done at a county or state level. Any of those types of sources of data, or even if you go national, things like Kids Count from ADKC can be great sources of data to help you understand kind of what's happening at a community level. All right, so for your data collection section, I'll go ahead and share a little bit how you might collect data for your project. We're low on time, so I'm going to keep moving forward here, but encourage you to think about how you might do that data collection for your program. Now, let's have a question here. How comfortable are you using Excel to develop charts, graphs, and reports of program evaluation data? I've got this slide up here again. You can use your phone to snap the QR code or go to that website. If you still have it up, it should just refresh on that page. And go ahead and drop in how comfortable you feel about using Excel to develop some of these charts and graphs for program eval data. We've already got 4 responses in. That's awesome. Go ahead and respond because I'm very curious to see if people feel comfortable using it. We actually have this conversation come up in the chat. Connie shares that she has using Excel for large data sets and that sometimes you have issues. Interesting. Recommendation for a tool that can sort and analyze large data sets containing codes, injuries, demographics. Oh, okay. Yeah, once you get into the thousands of lines of data with Excel, sometimes it can be a little bit slow. It's challenging. It also depends on your computer processing speed too, so that's a big one. So sometimes it might not be necessarily Excel, but it might just be the processing speed of your computer. But you can use some other tools. I actually really like the tool R because it's free, but you just have to be comfortable doing some coding. And that's where it can get a little bit tricky to use a tool like that. But I might recommend that one as another alternative. All right, let's see what our responses are looking like. I mean, if I had to, 41%, I love it. And then 41, I love Excel. Okay, oh man, and then we've got 18%, don't ever talk to me about Excel. I love it. Some good responses in here. You know, one of those things that I've learned, you know, there's always like a barrier to like a new tool or something like Excel. But there are all kinds of resources online. And if you just Google something or search something on YouTube, you could probably find some great introductions to the tool if it's something that's new for you, to find different ways that you can use it for what you need to accomplish. Speaking of, if you go to my YouTube channel at Common Good Data, you'll see I've got some videos that I call Excel tutorial for social workers. I've got 4 videos up and I'll have a few more in a little bit. So you can check those out, but there are other people who do great things on YouTube as well, where you can find some answers as well. So why do we talk about Excel? Excel is kind of that common way of doing analysis. So when you're doing your analysis of pre-post data, it's a great tool to use. But maybe you're working at a community level, or maybe that you want to draw from somebody else's dashboard or develop your own. So I'm going to actually talk a little bit about both of these again in the 3rd workshop when we talk about the importance of reporting data. Because once you do these surveys, the key is you got to get that information out in the community and make it digestible and understandable for people so they know what they are, they know more about your organization and the impact that you have. You know, here's an example from North Carolina Detect that looks at mental health, and you can look at county by county level indicators for different indicators. Really helpful to have dashboards like that. Here's an example of a prevention dashboard that I created that just focuses on just outputs, things that you've done, like how many naloxone and bottle cabinet locks have you distributed? You know, what were your activities by different subgroups like gender, population, you know, how many people did you reach through workshops and trainings? So tools like this can be really helpful on a quarterly basis just to get a sense of what you're doing and communicating that work, even if it's just internally to other people in your organization. Building dashboards in Excel can be a great way of communicating that information out on a regular basis. And we're seeing that come up more and more and more, kind of almost like an expectation that you're being able to track that data and to show it with others. Jack Cohen says, a training on how to utilize Excel to create dashboards would be helpful. Check out my YouTube page. There'll be more there too as well. And there's great other sources beyond my channel that are very, very awesome as well. Okay, I know we're getting close to the end here. Reporting, a couple things to keep in mind when you're reporting out on your evaluation data is just to keep clarity on who your audience is, because the report that you send to a federal agency versus a state agency versus a community foundation are all going to look very different. And then what you post on your website just for the general public might look different. I actually have been starting to accompany annual impact reports that I do with organizations that do kind of their organization by the numbers with a 2-minute YouTube video, because you know you want to have some way to communicate that on social or send it out via email or in a newsletter. You know, people might watch a 2-minute video but might not be able to read a 30-page report. So keep in mind what that audience is. You're always tailoring the information you have in evaluations to that audience. We did make it to the end here. Excellent. We're going to skip that question. We made it to the end. Folks, if you have questions for me, I should have changed that link there for commongooddata.com/simple, because that's where we have for this toolkit, but I've got a grant waiting run too. Feel free to email me, drew@commongooddata.com. I also got resources on my website and podcasts. Would be happy to assist in any way that I can. If there are any additional questions that we have, feel free to drop them into the chat. And I know that Olivia and Amber are also going to be talking about evaluation, so they'll drop that link in the chat as well. So feel free to drop questions and I'm happy to answer them.
Awesome, Drew. A huge round of applause. That was awesome. Sitting on a 2-hour webinar can be really difficult for your brain not to wander. And if it did for me, it was in a good way. So huge thank you. You make this easy to understand and fun. And we're really looking forward to the next 2 sessions.